The coronavirus pandemic has been chaotic for countries all over the world. It has especially hit hospitals hard and put lots of strain on their capacity and capability at treating patients. Some counties in Virginia have extra hospital beds, while a few other counties have high utilization. Instead of having patients go to hospitals that are crowded, the utilization information can be available at their fingertips. They can make informed decisions to go to the hospitals in a nearby county. This makes us wonder, how can we better the situation if it were ever to come up in the future?
Let us take you to the next view. Here you can see the age group graph, and the highest number of active cases, as you can see, is between ages 30 through 39. In this group, there are around 2,600 total active cases and has around 200,000 in deaths. According to the earlier predictions, elderly men and women were more susceptible to COVID, but what we see here is that the middle-aged group is more affected by this disease. Moving on to the next graph, this graph showcases all the cases in the assisted living community. You can see here that the nursing home has more than 4,000 active COVID cases and is the highest out of all the other assisted living groups. Multicare has around 3,000 active cases, which is the least among all the groups.
As you can see on the hospital bed utilization graph, bed occupations in Virginia hospitals have skyrocketed and almost doubled from April to May. The same can be seen for the capacity of the hospitals. This shows that the hospitals are under constant stress in terms of patient space and equipment usage. Also, there's a major inverse relationship that can be seen in the terms of bed occupations and PPE supply. As the patient number skyrocketed, the PPE supplies dropped almost to zero. This did not help the overall situation of the already crowded hospitals. Now they were also low on PPE, meaning the spread of the virus would increase and even more cases would occur. So it's very important that people have instant updates on vacancy and PPE supply for their surrounding hospitals so that they're able to get quick and safe treatment from their hospitals.
COVID-19 caused many casualties for us, and one of the main challenges for all these casualties was not knowing where to go. The hospitals had shortage of beds, ventilators, equipment, and other facilities. Lack of relevant medical information that's accessible to the public regarding hospital care availability. A solution we propose is we launch a government-issued app that shows the capacity and the PPE supplies of levels of every local hospital near you. This app allows patients to see which hospital has the least amount of people, how many beds are available, and if the hospital is well equipped with PPE. This will allow patients to get instant data down to the minute by computerized system in hospitals that keep track of the admitted and discharged patients. So now patients can see which hospitals have room for them. The computerized system keeps track of PPE stock inventory for each hospital. So if a hospital is low on PPE, the patient would go to a different hospital to help the other hospital have time to restock supplies.
Capacity is different for every hospital in every county. Patients tend to go to overcrowded hospitals while there are vacant hospital beds in their neighboring county. The best way to evenly separate and distribute patients into every hospital is to create a government-sponsored app so every hospital can put the number of beds they have available in their profile. The coronavirus has had a huge impact on our world. Schools, offices, and public places have closed down in order to avoid the spread. If our attempts to avoid a catastrophe like this in the future don't work out, we can always use this app to choose the right path.